32% of 710 surveyed nurses here in the United States said they would leave their direct patient care role within the next year. Back in 2020, I left my ER nursing job to pursue a job in outpatient nursing, specifically an infusion center. And although I may not be working in the outpatient setting anymore and I'm back to inpatient nursing, I can feel for these nurses. So what about you? Are you considering leaving your direct patient care role in nursing and pursuing something that does not involve patient care? If so, this video is for you because today I will be giving you 10 jobs that have absolutely no direct patient care to them. Before we get this video started, please hit that notification bell so you are alerted when I am posting new videos, and please subscribe to my channel and maybe give this video a thumbs up too. But other than that, that is it. Let's get into today's video. In no particular order at all, we are going to start with number 1, case management. Case managers develop, implement, and review healthcare plans for patients. Now, case managers can work in a hospital, they can work out of a hospital. Case managers can work in a whole bunch of different places, but it involves no direct patient care. And a lot of people think when no direct patient care is involved in your type of work, you're also taking a pay cut. The average salary for a case manager is between $67 to $80K a year. All right, moving on. Number 2 is remote nurse working. Did you even know this is a thing? Well, it is, and I use this term as an umbrella term. If you go to Google right now and type in nurse remote working, the first thing that came up for me was 26 different positions, 26 different remote nursing jobs. The first actual job posting I saw was a virtual nurse coach, and that was a salary of $48 to even $84 a year. Now, this may be what you want to look into, especially that it's remote. Again, in no particular order, number 3 is a legal nurse consultant. Legal nurse consultants, or LNCs, help with analyzing medical records. They then deliver their professional opinion on that record. Now, these nurses can work in law firms, they can work in doctor's offices, they can work in hospitals, or even at insurance companies. And that's not even a full list of where they can work. The majority of LNCs make between $73,000 to $112,000 a year. Fourth up is an informatics nurse. Nursing informatics is a specific science. They identify, collect, process, and manage data. This helps them to support the nursing practice and administration, also education and research. An informatics nurse can make anywhere between $42,000 to $102,000 a year. Okay, we are halfway there. Bear with me. Number 5 is a risk management nurse. Risk management nurses analyze existing practices and then they make changes to that as they see fit and what the data says. Now, risk management nurses can make a lot of money. This is the highest paying position of the 10 positions I am giving you today. Risk management nurses can make on up to, and this is just here in Atlanta, $143,000 a year. But let's keep going. Number 6 is a nurse manager. Now, I know some of our managers may help on the floor from time to time, but that's not what they are actually there to do, and that's why I added them to this list. Nurse managers can make anywhere between $68,000 to $120,000 a year. And I didn't even think to add the director of nursing or the chief nursing officer or nursing supervisors. So there's 3 more positions that do not involve direct patient care that we can add to this list. Moving on to number 7, that is forensic nursing. Now, forensic nurses can work in correctional facilities and helping victims of violence. But these nurses also work with medical examiners and coroners. They also can help in legal cases for violent crimes. The average salary here in the United States for a forensic nurse is $70,000 a year. All right, just 3 more to go. Let's keep going. Number 8 is a health policy nurse. These nurses help to form and communicate health policies. The goal of this type of nursing is to improve the overall health of your community. HPN salaries can range anywhere from $64,000 to $112,000 a year. 2 more, here we go. Number 9 is a nurse coordinator. These nurses organize treatment plans between the patient and the physician. Really, they're working as that middleman. Now, you can work in different types of specialties in this role. Quick story, my dad needed a liver transplant, and he had a nurse coordinator who helped coordinate everything, helped coordinate blood work, helped coordinate the day of actual surgery and what that looked like for him, but not only him, but for the family as well. And we loved that nurse coordinator. On the low end, nurse coordinators can make $78,000 a year. But on the high end, which is why I didn't say this is the highest paying one, because they can make $78,000 a year, but on the high end, they can make $168,000 a year. That is the highest paying on this list of 10. But I made it number 2 because that $78,000 bumps them down. The last position that I have for you today is a nurse recruiter. The job description is right in the name. These nurses recruit nurses. They can be a travel nurse recruiter, or it can be a recruiter for a specific hospital or even a college. Now, nursing recruiters also can make very good money. On the low end, $67,000 a year, and on the high end, $109,000 a year. So what do you think? Do any of these positions interest you? If so, comment down below. I would love to hear which one you would be interested in going into. I have links to all the information shared in today's video in the description below, so if you are interested in looking into any of these, there are links in the description below to each one of these. But other than that, that is it for today's video. Thank you for tuning in. Make sure you are subscribed to my channel, please, and give this video a big thumbs up. Other than that, that's it. I'll see you guys later, and have a great week. See ya.